Let me begin with a situation many therapists may encounter. A young woman of 20 came for counseling. She said that she felt confused about life, about relationship, and about decision making. Interestingly, she did not speak about any serious crisis, but she repeatedly said something that was very interesting. She said, "Whenever I make a decision, I feel I'm betraying my family." Now, that sentence does not mean anything, but it can also have certain clinical significance, such as, is this anxiety? Is this dependency? Or is it something to do with cultural conditioning? Or is something serious happening to this particular person? Today, let's dive in to see how we can address this case together. Welcome to this channel. My name is Danny and I am the founder and director of Atmanam, Center for Counseling, Psychotherapy and Skills Training. I've been a therapist for the past 20 years. I was working in trauma care and have a lot of teaching experience. In this series, we will do something very important. We will enter the therapy room together. We will try to understand the cases that I have encountered in my experience. Of course, we will have the age and the names changed because we want to maintain confidentiality. In the series, we will also try to understand what is a case and how theories are involved in case descriptions and how we can create hypotheses and see how we can come about to pointing the problem that exists and we work out towards a significant solution. This is for serious learners, and we together as young therapists will try to understand this case and we will try to come to a certain understanding. Let us come back to our case. The client, let us name her Ashwini, is a 20-year-old young lady. As she came for counseling, the issue that she started describing was she was feeling guilty, anxious, and emotionally stuck. There could be a lot of inferences that we can gather from what she said. Ashwini comes from a very close family. Her parents were deeply involved in her welfare. At first glance, this might sound very normal. But as the sessions proceeded, she said something that was very interesting. Almost every decision that she made was made by the parents, whether what she should do, whom she should talk to, what career choice that she can pursue, and every small decisions needed the stamp of authority of the family. Ashwini herself said that sometimes it feels as if it is my decision or it is the decision of my parents. This statement has clinical significance. Now, at this stage, as therapists, we might draw conclusions and jump into situations, but let's pause. Instead of doing that, we will try to understand in terms of creating hypotheses. At this stage, several explanations might come to the fore. From the developmental perspective, it could be that Ashwini is searching for her identity and autonomy. According to Erik Erikson's developmental theory, young adults often at this stage search for autonomy and identity. From a cognitive perspective, we can explore and see what kind of belief system that Ashwini has. Probably her belief says, if I question, then I am a bad daughter. From the diagnostical statistical model using the DSM and the ICD, we can even explore and see whether there are any significant impairments, such as anxiety disorders, or is it dependency? But according to another theory, that is family systems theory by Murray Bowen, it could be that there is something to do with the family establishment itself. According to Murray Bowen, there is always a need for independence and differentiation. Let me explain. A person needs to draw the line of independence because they are an individual. But at the same time, they have to live and move and grow within the family system. So therefore, if a person does not have that particular independent creation, and at the same time, they can also independently be part of the family, then there could be certain issues arising. In Ashwini's case, she sometimes says that I don't know sometimes whether it's my decision or my family's decision. Because Ashwini is so dependent on the family that every little decision, where to go, whom to speak, what career choices should I make, everything depends on the family. So according to family system theory, this could be family enmeshment. So now let us try to understand whether this could apply to Ashwini's case. Now we have created our hypotheses. The next stage is to test whether those hypotheses are right or which hypothesis is relatively close to this particular case. Now, when we are going through this process of counseling, Ashwini had mentioned that she was very close to her family. On questioning, we asked her whether she has disagreed with her parents in anything. Somewhat, Ashwini felt that disagreeing with the parents would be a crime that would lead to a lot of anxiety and guilt. But then she would feel by accepting everything that the parents said would also sort of make her emotionally stuck. She was caught up in this particular crossroad. Now, on asking her what she can do about it, she says, I don't know. Ashwini also mentioned that they actually did not disagree, but they all agreed to everything. According to Murray Bowen's family systems theory, this is enmeshment. As I explained to you before, there is a distinction between individuation and differentiation. In this particular family where Ashwini lives, the individual members of the family do not have clear boundaries. They believe that the entire family is one boundary, therefore they feel the need to comply. But at the same time, the contradiction arises because developmentally they are moving towards independence or they are creating their own identity. So therefore, this contradicts the exact situation that they are in. So they feel stuck and they also feel whether I need to move forward or backward or should I remain where I am. And that is Ashwini's situation as of now. So what can we do about this particular situation of enmeshment that happens in the boundary? We can actually help Ashwini to ask certain serious questions. Cognitively, we can ask her, is her belief true? Is her thought process or thought patterns real? Or if it is so, how long would you continue to be? So in this case of Ashwini, her thoughts are intertwined with the family expectation. Therefore, it cannot be pathological or it cannot be something else as we have diagnosed. It could be a matter of family dynamics, especially enmeshments that can happen within the family. At this stage, our clinical diagnosing becomes clearer. It is not simple anxiety, but it is something that comes as a symptom of family dynamics. So in Ashwini's case, we can see that the anxiety and the guilt comes because of the unwritten rules of the family. And Ashwini becomes a symptom of the family who actually exhibits the emotional and the behavioral disturbances. So what we do from here on is to help Ashwini negotiate the difference between individuation and differentiation so that she will be able to find her ground and she will be able to create her own autonomy and independence. At the same time, she would also be able to build in emotional stability and bonding with the other members of the family. Now comes the most important stage. How can we intervene in Ashwini's case? Our intention here is not to break the family bond, but instead we have to point out what are the deficits that exist within the family that actually causes a lot of disturbance in Ashwini. So what we can do, firstly, is use the cognitive model by asking this question to Ashwini. Does your stating who you are means you are a bad person in the family? And how accurate is that? This question or this line of questioning can give clarity to Ashwini to think that asking questions or putting her side first does not mean that she is breaking away from the family. And from the family system's perspective, we encourage Ashwini to give her point of view in family discussions. She can also learn to say no realistically without hurting the family bond. And this can give a lot of confidence to Ashwini. Keeping in mind that our intention is not to break the family bond. Change can be overwhelming, and for Ashwini, who is in her 20s, making a drastic step would be terrible, which could create a lot of anxiety. We also help Ashwini to make smaller steps so that she can break the bondage of anxiety. Probably she can make smaller decisions, she can voice out her opinions, and probably she can also take responsibility for her actions. Another thing that can arise from this situation is anxiety, which is a normal thing when changes occur. Now we encourage Ashwini to embrace anxiety because changes brings anxiety. Though these anxieties that she can face in the coming days could be only temporary, because she will try to understand the nature of that anxiety and she will be able to overcome the anxiety. Thirdly, we ask Ashwini to make smaller changes in her day-to-day patterns of relating to people. But with support and reflection, Ashwini can come back to her own self. Ashwini can create her own identity, but we should always remember that changes brings discomfort. Over time, Ashwini gathered confidence. She was able to make smaller choices and decisions. She was able to speak her mind to her family members. Surprisingly, the families did not condemn her. Rather, they tried to accommodate her point of view. Now, Ashwini started feeling much more confident in spelling out her mind, and she always found that her anxiety began to decrease. She also felt that she could connect to each and every member of the family more emotionally. This is psychological growth. And that balance is an important marker for psychological growth. This case offers three important insights. Number one, the individual is not always at fault. Sometimes the exploration into the situation also gives us insights into the case of the client. The second insight that we can draw is the understanding of the family systems will actually change the course of our therapeutic endeavor. The third insight that we can draw from Ashwini's case is individuation and differentiation are important things for human growth. Cases like this can also present certain challenges, such as we can be quick to judge the family system. In counseling, we do not make moral or religious judgments on the individual or on the system. The second challenge that can arise is the cultural context. How one could relate culturally is a subjective choice. The third challenge is to move with the client space. If differentiation happens too quickly, the client might feel more anxious. So in counseling, it's important to walk the journey along with the client at the client space with reflection and careful pacing. Let me leave you with a few questions for our reflection. As therapists, how would you differentiate between family bonding and family enmeshments? At what time does support becomes restriction in relationships? If you were to be the therapist, what would have you done differently? I'd love to hear your thoughts in the comments. You can also suggest clinical situations and cases that you would want us to explore in the coming episodes. Until then, keep reflecting, learning, and growing as young therapists. Follow us for more content like this, and please do subscribe.